Effective with the implementation of PDPM on October 1st, 2019, the documentation burden will begin to shift from therapy to nursing as patients entering skilled nursing facilities from acute care are admitted with the presumption of coverage for skilled nursing services. There are 4 principled skilled nursing services that require Medicare charting: observation and assessment, management and evaluation of a care plan, teaching and training, and direct skilled nursing care. Observation and assessment. Documentation must reflect when the likelihood of a change in a patient condition requires skilled nursing to identify and evaluate the patient's need for possible modification of treatment or initiation of additional medical procedures until the patient's condition is stabilized. Number 2, management and evaluation of a care plan. The development, management, and evaluation of a patient care plan based on the physician's orders and supporting documentation constitute skilled nursing services. Nursing will need to document the services that require the involvement of skilled nursing personnel to meet the patient's medical needs, promote recovery, and ensure medical safety. Teaching and training. The documentation must thoroughly describe all efforts have been made to educate the patient or caregiver and their responses to the training. Medical records should also describe the reason for the failure of any educational attempts. Topics of teaching include colostomy care, insulin administration, prosthesis management, catheter care, G-tube feedings. Number 4, direct skilled care. Nursing services are considered skilled when they are so inherently complex that they can only be safely and effectively performed by or under the supervision of a registered nurse, or when provided by regulation, a licensed practical nurse. Daily skilled nursing documentation should include vital signs for each shift, activity level of the patient, pain assessment, physician exams and order changes, lab results with physician notice, equipment needs, therapy progress, daily assessment of skin, lung sounds, cognitive status, and edema. Beginning October 1st, 2019, a Medicare Part A patient will be placed into a PDPM clinical category based on their diagnosis and clinical conditions. Nursing documentation will need to support the skilled care provided to the patient based on his or her specific clinical category. For patients who qualify for the acute infection category, include in the daily documentation infection treatment and response to the interventions, signs and symptoms of the infection present, assessment of infection source and site, transmission-based precautions if applicable, lab and diagnostic testing and results, and vital signs. For residents who qualify for the acute neurological category, include in the daily documentation mental status, pupils, hand grip, feet flexion and extension, mouth pain, dietary consultation, swallowing issues, and ADL performance. For residents who qualify for the cancer category, include in daily documentation current treatments and response to treatments, nausea, appetite, adverse reactions from medications, appointments and follow-ups, incisional care if applicable, psychosocial and spiritual needs, and pain. For residents who qualify for the cardiovascular and coagulations category, including the daily documentation, pulse, heart rhythm, capillary refill, JVD, edema, weight changes associated with edema, lab and diagnostic tests performed and analysis of results, pain, incision description if applicable, incision care if applicable, medication adjustments, shortness of breath of any kind, lying flat, exertion, and/or at rest. For residents who qualify for the major joint replacement or spinal surgery category, including the daily documentation, incision care description and assessment of sight, color, circulation, and integrity, resident's pain, weight-bearing restrictions, ADL status, and restorative or therapy provided. For residents who qualify for the non-orthopedic surgery category, include in the daily documentation surgical wound care provided, assessments of affected site, signs and symptoms of affection, pain assessment, post-procedural complications, vital signs, the resident's activity level, and any follow-up appointments. For residents who qualify for the orthopedic surgery category, include in daily documentation surgical wound care provided, assessment of affected site, post-procedural complications, incision care and description, pain assessment, vital signs, resident's activity level, any braces, splints, or devices, therapy or restorative services provided, and any follow-up appointments. For residents who qualify for the pulmonary category, including the daily documentation, respiratory assessment, breath sounds, and any pain with breathing, shortness of breath of any kind upon exertion while lying flat or at rest, appearance of the nail bed, lips, mucous membranes, and skin, oxygen saturation, respiratory therapy, type and amount of oxygen used, medication use, cough, describe the frequency, productive versus non-productive, and any diagnostic tests. Key nursing documentation components. Effective with the implementation of PDPM on October 1, 2019, the documentation burden will begin to shift from therapy to nursing. Nursing documentation must reflect the need for the continuation of skilled care. Nursing documentation will need to support the patient's PDPM clinical category. 4 principled skilled nursing services: observation and assessment, management and evaluation of a care plan, teaching and training, and direct skilled nursing care.